What is a nurse practitioner and what do they do? Hey guys, my name's Rafa, and in this video, I just want to talk to you guys a little bit about how we as nurse practitioners are different than nurses, physician assistants, and the doctors themselves. Whether you're a patient that's trying to understand why was I booked with a nurse practitioner and not the doctor, or you are just someone that's exploring these as career paths, I'm just trying to make it a little bit more simple and easy. Now, full disclosure, I am a physician from Venezuela. When I moved to the United States, I got my registered nurse license and eventually became a nurse practitioner. Today, I'm working in orthopedic spine surgery, both in clinic and in the operating room. So I've seen these roles from multiple perspectives. At the end of the day, a nurse practitioner is a healthcare provider. We can evaluate patients, diagnose, order, and interpret testing. We can prescribe medications, and we can develop a full treatment plan. One thing that makes our role a little bit unique is our nursing foundation. Many nurse practitioners already spent years caring for patients as registered nurses before becoming a provider. We've answered the questions at bedside. We've explained medications. We have reinforced treatment plans. We have seen firsthand where the patients are struggling once they leave the office or they're discharged from the hospital. This experience tends to carry over into how we care for patients as providers. We're not just thinking about the diagnosis, we're also thinking about whether the treatment plan is realistic, it's understandable, it's something that the patient can actually follow. Another important thing to understand is that nurse practitioners train within a specific patient population focus, such as family medicine, psychiatry, pediatrics, women's health, or acute care. Today, there are more than 430,000 licensed nurse practitioners practicing across the United States. Okay, so let's talk about schoolwork and training. How did we get to become provider? You become a registered nurse. This is going to be through either an associate's or a bachelor's degree program. You pass your nursing boards and then you get your RN license. From there, nurse practitioners are going to complete a graduate education through either a master's or a doctorate in nurse practitioner program. That training is going to include advanced coursework, pharmacology, pathophysiology, physical assessments, diagnosis, disease management. We're also required to complete supervised clinical rotations across multiple specialties and practice settings. So after we graduate, we must pass a national board certification exam and obtain the state licensure before we can even start seeing patients. Like any other professional in healthcare, we maintain our certification and our licensure through ongoing continuous educations. So now that we know a little bit about how nurse practitioners are trained, let's talk about how we compare to other roles such as nurses, physician assistants, and physicians. So, as a nurse, we're going to help patients understand and carry out a treatment plan. This plan that was already created by any type of provider. We educate them, we answer their questions, we can administer medications, explain the medications to them, their side effects, etc. So, we're going to help coordinate their care. Once we become nurse practitioners, we step into that provider role. Now, it's not just about following through on the plan, but we can evaluate them, we can diagnose them, and we can manage their overall care. When it comes to physician assistants, if you're seeing it from a patient perspective, there's not much difference. It's a patient facing role. You're going to receive the same care from both of us. If you're seeing it from a student or potential career point of view, the only difference is going to be the pathway that we take to get to our final goal and title. When it comes to physicians, they do get a more detailed, extensive, and broad training through medical school across all of medicines before they decide to specialize in the area that they want to work in, which is the contrast between us. Since very early stages in our training, we just kind of decide what area we want to stay and we just focus on that particular one. So, what does this actually look like in real life? Let me give you an example from my own practice. I work in orthopedic spine surgery, both in the clinic and in the operating room. So, one thing that patients don't always realize is that when they're scheduled with me instead of the surgeon, it's often a good sign. In our practice, every new patient is, of course, first going to be seen and evaluated by the surgeon. He's going to come up with a treatment plan, which is what I carry out and follow through. So, if you're seeing me in a follow up, it often means that we're focusing on conservative treatment. We're trying to help you improve without surgery whenever possible. This may include medications, physical therapy, activity modifications, injections, or other type of non-surgical options. I can review imaging, monitor your progress, prescribe medications, perform procedures such as trigger point injections, joint injections, etc. Part of my job is also recognizing when conservative treatment is no longer working, when it's time to have a more serious surgical conversation with the surgeon. Although patients may see me independently in clinic, every patient that I see is discussed with the surgeon either before or after their visit. Then, when it comes to surgery days, I work as a first assistant in the operating room. It's a great example of how different providers work together to help patients get better while using the least invasive treatment necessary. I hope this video helped you better understand the role of a nurse practitioner, what we do, how we're trained, and how we fit into today's healthcare system. If you found this video helpful, please, I'd appreciate it if you click the like button and subscribe. I'm trying to create content about all the thousands of questions that I get daily in consult with patients. Thank you for watching, and I'll see you on the next one.